everyone, I am your host for this special edition of our Facebook Live. My name is Jennifer Williams, and we are so excited to be here with you today because not only are we celebrating the end of Nurses Week, we were also celebrating Hospital Week, and we have a very, very special guest. I am so lucky to get to sit down with our president and CEO of Cooperman Barnabas Medical Center, Rick Davis. We are going to be talking about the opening of the Melchiorre Cancer Center, the northern destination for cancer care and for RWJBarnabas Health and Rutgers Cancer Institute, and celebrating our amazing team here at CBMC. We even may test Rick's CBMC knowledge in a trivia contest. So if you have a question for Rick, or if you just want to say something nice, leave us a comment below, and please help me welcome Mr. Rick Davis. Hello.
Jen, great to be here with everybody and you.
This is so exciting to get to do this with you. So thanks for having us and letting us kind of ask you a few questions. So let's just jump right in. You have been a part of, in particular, CBMC and RWJBarnabas Health for 14 years. Why did you decide to go into healthcare?
The short answer is I needed a job.
Yeah.
Longer answer is, once I got in, have never come out. I've been working 14 years here, as you mentioned, 32 years all in the career in the industry, and just love the fact that at the end of the day, even for a person like myself, that an accountant by education and background, what I've done over the years and what I continue to do in this role really helps our great physicians and nurses and technicians provide patient care, and I get a real kick out of that. So it's exciting industry to work in.
It's just interesting, right? Because people think healthcare, they think, oh, you're a doctor, you're a nurse, but there are so many opportunities to get to still help people and help our community. So it's exciting even for myself as someone that's in marketing. So it's cool to hear that we can go beyond.
Yeah, I tell a story for our new employees. When we welcome them in our orientation, that at a sight of drop of blood, I literally will pass out. So
you're like, I stay away from
it's good that I stay on kind of this side of the.
You're like, I'll get you everything you need, but just keep me out of that.
Correct.
And so, there are so many wonderful things happening here. What are some advancements that have happened that have made you really proud?
Well, in my almost every day, it seems like in my 14 years in this healthcare system, particularly this site is transforming.
Yeah.
I think clearly one of the big ones is our name. It used to be formerly St. Barnabas Medical Center, and through generosity of the Coopermans, Leon and Toby, it's now the Cooperman Medical Center campus. And from kind of a bricks and mortar standpoint, a new patient tower. Significantly expanded, almost doubled our size of our emergency department. We've added in 2 different phases 6 operating rooms to take us to a total of 26 now, and just a whole host of new personnel as well, physicians, nurses. We've grown as our campus has grown, so significant transformation, and I guess in time, what's putting kind of a point right now on it is the Melchiorre Cancer Center. I know you touched on that in the opening. Very excited to have that coming at us quickly. We've had a soft opening of our radiation oncology department over there, but the official grand opening is coming sometime in the summer of 26. So we're excited.
And what would you say makes having kind of everybody in one roof in this beautiful comprehensive cancer center, why is that so important for our community and so important for patients?
Yeah, I think transformationally it's going to provide just better patient care. To have your medical, radiation, and surgical oncology, not only services, but care providers all under one roof is going to be just that much better for our patients that unfortunately have a diagnosis of cancer. To have their clinical care teams there talking about their care plan and how to attack that disease is going to be fantastic.
Yeah, it's a beautiful space, and it'll be so lovely, like you said, for people to just go to one spot, everybody's there, and that great care and that teamwork is so present there.
But yeah, and just one other thing I want to add is the really great structure that we have within our healthcare system. The partnership with Rutgers and in this case, Rutgers Cancer Institute, we become that northern hub, as you mentioned, for those, that arm and research and care plans and the like. So again, we think it's going to really advance cancer care in our community.
And all of those things don't happen without great teamwork. And I know that's something that's so near and dear to your heart. What makes the CBMC team so special? And what are some wins that have gotten you really excited as our CEO?
Well, I think, a lot of CEOs that sit here and talk about various aspects of team. I think beyond teamwork, and I'll talk a little bit about some examples, but I think we also have a real family feel as well. It's something I think that maybe is kind of a Jersey thing more than maybe other places that I've been.
That's true.
But the teamwork does come together for our 4,200 member roughly team. We also work in a team approach with the 45,000 members of the entire healthcare system. We are one system, one family, and we just have a whole host of examples here of very small projects, large projects, where our team comes together with our mission in mind of ultimately taking care of patients in our community.
Do you want to tell us about like one or two of them that make you?
Yeah, would love to. So maybe on the smaller side, I'd like to give a shout out to a couple of our, and thinking of 2025 kind of successes here. Nellie Vitug, and she's our clinical director of One West, our step down unit, and Anthony DeTrilio, who's our one of our managers in our MRI department. They came together and worked on how to efficiently or more efficiently get a patient from an inpatient unit in the MRI and back. Simple thing to think, but they came together, including their entire teams, to work on that communication in between teams in order to make an impact on patient. So very small project. And then we had a really massive project last year that our Chief Operating Officer, Jen O'Neill, really spearheaded, and it redesigned our interdisciplinary rounds, and those bring together teams of clinical caregivers, physicians, nurses, our case management team, social work and the like, in order to, again, talk about in a live, daily way the care plan for the patient so that we can more efficiently get them better and get them onto their next destination in their healing process. So really excited for the results there. We just can't say more about my team. Fantastic.
And I'm not just saying this because you're sitting here and you're our boss, but you give us that space to do it and to achieve our goals and to make kind of the space to do what we need to do to make things really great. And so we're lucky to have you. Truly, I do mean that. I'm not just saying that, everybody, but you're a great who's like the point guard in basketball or the captain of the team? Or...
Well, I very much appreciate the kind words, but again, as I said, accountant by education, not a clinical caregiver. So
you can do anything in life, right?
That's right. My job to make sure that we have all of the resources that our people need to be successful.
Yeah, and it's awesome, and I'm sure it's very stressful. So what do you do to kind of relax and unwind outside of work?
Probably the two main things. Love to travel with my family. We've been to a lot of great places. I'm a big national park fan, so love to go around and get a little passport stamp.
There's a lot of those. I was at an event yesterday, and someone else was touring national parks too, and there was like thousands and thousands of them.
So again, grew up in the western part of the United States, so big parks out there. Grand Canyon. Cool. Yosemite and the like, had done a lot of that in the West, but back east there is just so much history here, and have really loved my time on the East Coast. So traveling, and then also cooking. Can tell by maybe the midsection a little bit. Love to cook. My wife and I, she's kind of more of the baker.
Okay.
I'm more of the maybe dinner expert.
Is there like something that you're like the master at?
Again, grew up in Las Vegas, Nevada. So Southwest. Okay. Love anything kind of taco, enchilada, chili relleno related.
Okay.
And
do you like it like super spicy, or do you like it more mild?
More heat on my end.
Okay.
I'm gonna say
that's where you grew up.
My wife and daughter, and my son is a little more spicy. My wife and daughter are a little bit more.
Okay. So I think this is a good time. We're going to test Rick's CBMC knowledge. So I'm going to ask you a few questions. Don't be scared.
I better get these.
Hopefully you answer them well. Okay. Number 1. Which CBMC team has gotten 7 years county-free, meaning that patients on their units who have had catheters have gone infection-free?
I was there recently, congratulating them. It's our cardiothoracic ICU unit.
There you go. Great team. Okay, next one. This team is the only certified blank unit in the state of New Jersey.
That is our fantastic burn unit.
Mm-hmm.
Led by Dr. Abe Hong, and recent took over for Dr. Michael Morano, who retired, and just a great physician team, great nursing team.
And he was a resident here,
yes,
right? So
yes, he
come
was.
Back, full circle.
It is one of the unique services that we have here, clearly on the Cooperman campus, but really in the state and up and down the eastern seaboard.
Mm-hmm. Okay, next. In 2025, the Renal and Pancreas Transplant Division was named one of the top kidney programs in not just the New Jersey, the country. What number are they?
They are number 7.
Wow, all right.
Incredible team.
Amazing work that they do. It's really moving when I'm sure you've been over the years when you get to see living donors come together, and it's a beautiful thing. Okay, CBMC has been named to U.S. News and World Report's list as one of the top hospitals in the New York metro area and a top hospital in the country, top 100 hospital in the country by health grades. With those accomplishments, we were recognized as a high performer in numerous areas. Can you name just 3 of them?
I'll go 3 that are, I think, very special to our service line orientation. Our cardiac services are in orthopedics, total hips.
Yeah.
And also in the kind of the neuro vein, our stroke center.
Absolutely. Check.
Very excited about the designation as a certified stroke center that we received. And again, as hopefully everybody can tell out there, we do a wide variety of services, and we do them in a great way.
Yeah. We're at the tops. Okay, this one I didn't know when I was researching. This one's a cool one. In 2009, we were the world's first medical center to perform an all-robotic surgery in this specialty. What is that specialty?
I would have been researching like you as well, but because we just had a kidneyversary event, which celebrated patients who had, and we talked about our transplant service a little bit ago, a couple of questions ago, that had a transplant for 25 years or greater. And these patients came back here for an event. Great. So it was a kidney transplant in 2009.
Can you name who did it?
It's got to be the incomparable Dr. Stuart Geffner.
You got it. There you go. Okay. What year was CBMC founded?
That is 1865.
We're an old gal.
160 years last year. 161 this year.
Oh yeah, that was And where? Because we weren't always here in Livingston.
Began initially in Newark, New Jersey, and I knew that from the 150th, which was back in 2015. So 100 years in Newark, and then moved to the current Livingston campus in 1965.
Ooh, that's a bonus, everyone. I like that it's all round numbers. Well done, whoever planned that.
It really worked for this accountant sitting here.
Okay, next one. CBMC has been named as one of the top birthing hospitals by Newsweek. On average, how many babies are delivered here each year?
It's a big number. It's approximately 6,000 a year.
Yeah.
Give or take a few.
A lot of babies. A lot of cute little babies here.
And some of them need to go off to our level 3 NICU.
Yep.
And can't say enough about Dr. Bashara and her team. Those incredible the care that they provide.
More special,
there.
so special. Okay. This facility is home to the Kogan Celiac Center and the Matthew J. Morahan III Health Assessment Center for Athletes. I had to get that all in. What center is that?
That is our wonderful ambulatory center, just about 4 miles west of us. It's called the Ambulatory Care Center, the ACC.
The ACC, as we love to call it. Okay, 2 more. Our nursing team has received this distinguished recognition by the American Nurses Credentialing Center. What is that recognition?
Such an appropriate question at the end of Nurses Week. Magnet.
Yeah.
And we've original designation in 2018, redesignated 2023, and then clearly we'll be going for redesignation in 28.
And what an incredible team they are. Okay, last one. The Breast Center at the RWJBarnabas Health Ambulatory Care Center is one of the largest comprehensive breast centers in the state. On average, how many procedures do they do each year?
A tremendously busy center over at the ACC. It's in the mid 50,000, about 55,000 annually.
A lot of,
Yeah, it's very busy, very busy center.
Yeah, and they have so many, it's just not mammogram, there's like many.
And in part of the transformation was not only on the Cooperman campus, but also at the Ambulatory Care Center. And the breast center there was significantly expanded and revised, patient intake, a dedicated MRI. I mean, we've patient amenities, locker rooms, etc. We've really pushed the limits over there.
And so now with that, we've celebrated all the things we've kind of have accomplished. I want you to look into your crystal ball, and where would you like to see, or where do you see CBMC in the next 5 to 10 years?
It's a great question. And it's something that I think about in my position a lot. I think we want to make advances to our service offerings. I think we want to take even those that we do exceptionally well and just continue to have them perform at same or higher levels. Continue to grow our team and the physicians and the like. But we really want to advance our major service lines: cardiac, neuro, orthopedics, women's and children, pediatrics, cancer. And clearly with the Melchiorre opening, I think that, and what I previously mentioned about the incidence of cancer in the state, that's going to be our kind of our near-term focus, and really getting, as we have said to the community, the Northern Hub, we really want to make that come to fruition. So it's an exciting time to be a part of the campus.
Okay, so I asked this question to all of my guests on our Facebook Live. What is your best elevator pitch as to why members of our community should receive care here at CBMC?
Well, the elevator rides are pretty short. We're at max about 5 floors, so my elevator pitch has to be short and sweet, and would always identify by the button that they push where they're going, and then I can have one for every service that we have. It focuses on just clinical excellence, and then really trying to highlight the maybe 1 or 2 individuals that they're going to come in contact with, whether it's a doctor, a nurse leader, a tech, and just tell them what good hands they're in, and really make them feel comfortable about where they are. So it's tailored for you push a button, I'm gonna have a pitch.
You'll have something for us.
Yep.
What I have 2 more questions. What would you say you're most proud of as a CEO?
We've talked about teamwork a lot. We've talked a lot about the campus transformation. I think it is representing the 4,200 members of us. As you know, I go out in the community a lot. Whether it's a healthcare related event or any other, and I become the representative of this site and this system, and so I kind of bleed the red and blue of RWJBH, and I'm extremely proud of that.
It's always nice, right, and I'm sure you get this all the time, if you go somewhere and you say that you work here or for the system, people say, oh, like, I had the best care, or, this nurse was so kind to me, or can you please tell them, And I
literally was just at a gala for the Paper Mill Playhouse. It's a regional theater. This past Friday night, and we were a sponsor of the program, and so they recognize us and recognize that I'm there, and literally a couple came up to me, sought me out out of the crowd of probably a few hundred people.
So it's easy.
I am easy to spot, but to your point, they told me about the care that he had received, and really had gone through quite an ordeal, but just could not say enough about the team
It's
here
amazing,
and particularly our nurses.
Yeah.
So was able to give them a shout out yesterday at their award ceremony.
Yeah. So nice.
Yeah, it's
Happy Nurses Week too. Happy Hospital Week. Okay, my final question for you.
Yeah.
Now I forgot it. I'm gonna put my cards away. What would you say? You have your last few minutes here. What do you want to say to the CBMC team?
Thank you. I'm tremendously grateful for your efforts and your compassion and kindness, and love to go out and interact with the team, and just look forward to seeing everybody in the hallways and across the campus, and we will keep advancing here at Cooperman.
Awesome. Thank you so much for being here. This is great.
Yeah, thank you. It was a great time.
I hope we made it easy.
Really appreciate it.
So thanks everyone for tuning in, and we'll see you next time.